Okay, we're going to start with just the head and scalp exam. And like most things in physical diagnosis, we start with inspection, just looking for head and facial symmetry, patterns of hair growth, etc. I'm going to palpate the head and the scalp by moving the scalp tissue over the skull with my fingers. Okay. All right. Next, we'll move to the eye exam. And I'm going to start by having you look just right at my nose, please. I'm going to lower the lower lid so I can inspect the conjunctiva. Okay. And I'm going to turn the light up next to look for his pupillary reflexes, looking right at my nose. And I'm going to look both for the direct and the consensual response here, and do the same thing on the other side. Okay. Many of the techniques with the eye exam are things that are often also done along with the rest of the neurologic exam. I'm going to check the motion of your eyes. I'm going to look right at my fingers and just follow them while keeping your head still. I'm going to go in an H pattern. Keep following my fingers as they come in and just look for accommodation. Okay, relax. Very good. Next, I'm going to do the ophthalmoscopic exam. I'm not going to dim the lights here so that you can see what I'm doing, but while you're practicing this in your group, you may want to dim the light enough so that the patient's pupils can dilate a little bit to make the exam easier. I'm going to dial the light intensity down on my ophthalmoscope so that the patient's pupils will constrict a little bit less. And I'm going to leave my glasses to the side. Those of you who wear glasses may find it easier not to wear your glasses so that you can get your eye closer to the lens on the ophthalmoscope. Okay. If you can find something that's at about your eye level, perhaps something right about there, I'm going to have a light that's going to be kind of bright in your eyes. Best you can, just stare right past me. Okay. Now, I'm going to use my left hand here to both for my own proprioception and to steady the patient's head. Also, that way, if I bump into something, I'm going to bump into my thumb and not his eyebrow. And I'll get back here and check for his red reflex, and then gradually come in. And if I'm about 15 degrees from the midline, I should come in right in on his optic disc. And I'm going to trace the vessels back towards the disc, and then trace them out all 4 quadrants. Now just look at the light just for a minute. Okay. And I then do the same thing with the other eye. Okay. Next, I'm going to go through the lymph nodes of the head and neck region. And you can use any pattern you like with this. Just check for preauricular nodes and posterior auricular nodes. Moving back to the occipital area. Down the posterior cervical chain behind the sternocleidomastoid muscle. Coming up to the anterior cervical or tonsillar area here, and checking the submandibular and submental areas, and finally down just anterior to the sternocleidomastoid muscle. And finally then, the supraclavicular area, just bend your chin forward a bit for me. Okay. That relaxes the muscles to hollow out the supraclavicular fossa for you a little bit. Okay, fine. I'm going to examine the thyroid gland in just a minute. First, I'm just going to look at the patient's trachea to see that it's midline, which it appears to be. And now I'm going to have you, if you can just rotate about 90 degrees this way. And I'll give you a glass of water to hold here. And I'm just going to check my landmarks first here, starting with the thyroid cartilage, and then coming down to feel the ring of cricoid cartilage right below it, and just below that, I think this is the isthmus of his thyroid. I'm going to have you take just a sip of water for me and feel if that indeed moves with. Okay, great. Now, if you could put some water in your mouth and just hold it there. there are a lot of different ways to examine the thyroid gland. We've picked one that's consistent with how it's presented in the textbook. And I'm going to come over laterally to the isthmus and go just behind, just in front of the sternocleidomastoid muscles on either side. Let me have you swallow. Okay. Now, to get more of a exam on one particular lobe, you may either move the trachea slightly out of the way, if I was going to try to examine his right lobe a little better, or pull the sternocleidomastoid muscle out of the way and do the exam the same way. Can you swallow one more time for me? Okay. Finally, I'll take this opportunity to examine his carotid arteries, since this is the region that I'm examining now. And coming over, starting at the thyroid cartilage. And over here, I'm going to palpate the carotid artery on this side. And if clinically indicated, you might listen here for a carotid bruit. Once I've found my location, I'm going to use the bell. Okay. Now, anytime it's comfortable for you, just take a breath in and then stop breathing. Okay, relax and breathe normally. Then I'd repeat the maneuver on the other side. Okay, next we'll move to the examination of the ears and hearing. And I'm going to move over this way and take this opportunity to inspect the ear, the skin, the structure of the cartilage. I'm going to take a look in the ear next. There are a lot of different ways that you can hold the otoscope, and all of these were presented to the students in the lecture. My personal favorite is to hold it like a pencil and keep the smallest two fingers of my hand over the temple area just to stabilize my hand. It's helpful to me, especially when examining a squirmy infant, but it can be helpful in adults too. I'm going to move the pen up and back just a little bit and look my way into the ear canal. Okay. This is, if you need to test hearing, this is an opportunity to do that. Let me have you cover your right ear for me and tell me what it is that I whisper here. 21. Good. Here I have my 256 hertz tuning fork, and I'm first going to do the Weber test and see whether his bone conduction lateralizes to either ear. I'm going to put this right in the middle of your forehead, and can you hear this more in either ear? No. Okay. Equally well. Okay. Next, I'm going to do the RINA, or Rene test, to compare air and bone conduction, and take the base of the tuning fork and put it over his mastoid process first. Can you hear that? Yes. Okay, tell me when the sound stops. Now, can you hear that? Yes. Okay, tell me when the sound stops. Yeah. Okay, great. And those periods of time should be roughly equal.
Okay, so we're going to examine this patient today. She's got complaints of upper respiratory problems, some congestion, maybe a sinus infection. Okay, so we're going to do an HEENT exam first: head, eyes, ears, nose, and throat. Okay, so I'm going to go ahead and put on some gloves. All right, so how long have you been having these symptoms?
For about 2 weeks.
Okay, all right. So we're going to go ahead and look in the throat first. All right, what you're going to do is stick your tongue out and say, ah. I'm going to look in the back of your throat. Say, ah. Okay, just looking at the tonsils to see they're a little bit red. You're also looking for a postnasal drip on the back of the throat. You want to know if it's like a clear color or if it's green or yellow, something like that. So I'll put this in the biohazard. Okay. I'm going to press on her sinuses here. That's her maxillary sinuses. Does that hurt?
Just a little bit.
A little bit? What about up here? Does that hurt?
Right there.
Okay, that's her frontal sinuses. Okay. I'm going to look in her ears. I'm going to look in this ear. Okay, looking at the eardrum. Do you have any pain when I push there?
Not really.
Okay, or when I pull up there?
Mm-mm.
Okay. I'll do the same thing on the other side. Look in the ear. You want to see if the ear canal is red or if the eardrum is red? Any pain there?
Mm-mm.
Okay. All right. I'm going to feel for any swollen lymph nodes under her neck. So just go along and see if you feel any small bumps anywhere there. Okay, and also down the side of the neck. Okay, these are all your cervical lymph nodes and your submandibular lymph nodes. If any of them are swollen or tender, that's a sign that she might have a sinus infection. Okay, she's also been coughing a little bit. So we're going to listen to her lungs. What you're going to do is you're going to slide around and put your feet up there. Okay. And every time I touch your back, I want you to take a deep breath with your mouth wide open. Let it out. Okay. Is your mouth open? Okay, and then we're going to listen to the front also. So you listen to the top part of each lung, the apex. Do the hair. And then on each side you also listen towards the bottom of the lungs. And then you listen to the heart. Okay, so we're listening for any rales or rhonchi, which could be signs that there's a lot of mucus or fluid on the lungs, or wheezing. Wheezing would be maybe she's got inflammation or asthma, something like that. Now, another test you can do for a sinus infection is called the head tilt maneuver. You're going to stand up. All right. You're going to put your chin to your chest. You're going to bend down and touch your toes, or go down as far as you can, like this.
Right
Go
now?
ahead and do that. You just now keep your chin to your chest and keep it there for a minute. Now you're going to slowly come up. Come up real slow. And you go a little bit faster. Okay. And if you feel pressure across here when you do that, that's a good sign that you have a sinus infection also. Okay, so that's just a basic exam that the doctor does when they're having any type of ear problems, sore throat, coughing, runny nose, sinus problems, things like that.
So let me just start with this because I have equipment here, okay?
Thank you.
So you would tell me about just mainly your head areas and itchy eyes, some congestion, runny nose, but no problems with breathing or anything like that.
No problems with breathing, no.
Okay, so I'm going to just start. Okay, just start with the exam, okay? Let me just see. Any pain here when I do this? When I put pressure on here?
No.
Any pressure pain when I do that? A little? Yeah. How about when I tap? Any pain? A little bit?
A little.
Okay. All right. Okay. Any swollen glands I can feel? No? Okay. Can you swallow for me? Good. Okay. Nothing like that. Good. Okay. Could you turn around for me? Now I'm not trying to choke you. It's just to check your glands and also maybe your thyroid. Okay. Okay. Swallow for me. Good. Any pain when you do that? Good. Good. So I just feel it all down. Make sure your nose, your glands. Good. When you turn around again. Actually, okay, turn around again. Now I'm just gonna okay, looks good. Okay. This is just some ophthalmoscope or otoscope, okay? Just some light. Okay, so I just want to look at me. Just look at my nose, okay? So see. A little redness in the eyes, just a little bit. You've been rubbing it a little bit?
Yeah, it's a little bit itchy.
Okay, alright. So, I'm gonna look in your eyes a little bit, okay? So, actually, I'm gonna just finish some other things first. Open your mouth for me. I'm gonna put what they call a tongue depressor. But it may make you gag, but that's okay, right? Okay, I'm gonna press top a little bit, say very good. I know, don't get good. Okay, all right. It's a little red. All right. Okay. I'm gonna look in your nose. Okay, let's see. All right. Okay. 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 You've been kind of trying to have a little running nose,
I
right?
have a runny nose, yes.
Okay. All right. let me change this. I can write that again. I'm gonna look in your ears, okay? Just make sure that you replace the congestion. A little tug, a little pull. All right. Good. Your ears, no problems. They haven't been bothering you, right? Good. Okay. All right. Now I'm not gonna do the full eye exam today because it's not your vision's not changing, okay? I need another scope for that. All right. But otherwise, okay. Let me just listen really quickly to your lungs because you were saying you had no cough, by the way, nose, but we always worry about if you. I want to make sure you don't wheeze. If you turn around for me. Okay. Okay. Deep breath in. Yeah, out. In. Out. In. Out. In. Out. Good. Good. So that's out. Okay. So I just did the quick physical, and we're going to go to the other room and finish up. But just to discuss what I think you have, I think you may be having like what they call seasonal allergies. Usually happens around this time of the year, springtime, the pollen coming about.
Okay.
So it's not uncommon.